Good morning. Wanted to say a few things about this coronavirus epidemic, pandemic going on. As you all know, we are deep into the trouble now. It's in there. No country is an exception at this point. Basically, things to do is to understand the disease, how it spreads, and what we can do to protect ourselves and our families and friends and the community. Most probably all of us know by now that it spreads through direct contact, close contact, surface contact. We call it droplet infections. Means like if somebody who has got the virus, not necessarily the disease, a pretty chunk of people who might have the virus might not have the disease at all. We call the asymptomatic cases. If somebody like that coughs, sneezes, or touches something, for example, a surface of a office chair, table, computer screen, computer, keyboard, then a cell phone, handshakes, touching the same door handles, the bathroom faucets, anything that person touches can potentially have the virus. And then somebody who does not have it goes and touch those surfaces can have the infection. So that's pretty much how it spreads. And also when somebody coughs or sneezes, that spreads it in the air up to the distance of what people are saying, maybe 6 to 8 feet. That's called droplet infections. So that's how it spreads. Now, what we can do to prevent the spread? Number one is to stay home if you don't have to go outside. How long? Nobody knows for sure, but at least a week or two. When the virus is spreading at a higher rate, we call it in the expansion phase of an epidemic. Then if you have to go out for something which is very essential and unavoidable, for example, picking up some essential groceries, things like that, one person of a family should do that instead of going to a grocery store with the kids and things like that. Because more you go out, more you expose yourself. When you go to the stores, try to stay away from people at least 6 to 8 feet or 10 feet. Don't touch the surfaces what you don't need to touch. If you have the wipes over there, use the wipes before you touch the cart and then after you get back into your car. Try to carry some wipes if you have into the car. So as soon as you get your grocery in, you clean your hands and clean the surfaces like the steering wheels, the gearbox, things like that. If you keep it in mind that every potential surface you touch has got virus, every potential person you come across has got virus potentially, then you will know what to do. So that's about the prevention. Mask, the regular mask, the surgical mask people wear, and you see the pictures which is coming in the media, the people walking on the street with the mask. That is actually better than nothing. For example, like if somebody has got an infection, if you can wear that mask, you probably will minimize the spread of infection to the other people. But if I do not have infection and I wear a mask and I go to the places that I think that I'm sort of protected from catching an infection, that is a wrong idea. It does not prevent you to have an infection. Only the special mask N95, which is extremely short of supply. Even the hospital professionals, doctors, nurses, technicians, aides, they don't have enough number of this mask. For example, I got one mask, which was assigned to me, and I was told to use it for 2 weeks. Fortunately, I'm off, so I didn't have to use it yet. So that is the mask which is known to minimize the spread of infection to the people. Like if you have that mask, your chance of getting an infection through the inhalational route, like inhaling the virus, is little lower. So mask is not really, don't rely on it. If somebody has got an infection, he should put it on so that he doesn't spread it to the other people around him. Now, what to do when you have somebody in the family who has got infection? How do you know? If there is no symptom, you will not know. But if there is symptoms, like usually it's just a regular respiratory virus like any other influenza virus, the symptoms and signs are exactly the same. So a little bit of cough, running nose, sneezing, sore throat, a little bit of headache, a little bit of body pain, not sense of not feeling well. Those are the usual symptoms. Good thing is that majority of the people are getting very little symptom, if anything at all, and majority of the people are recovering of their own without any specific interventions. What to do if you get an infection? Stay home, obviously, at least for 14 days. Isolate yourself. Even inside the home, you isolate yourself from the rest of your family members. It's a hard thing to do, but it's doable. So, for example, just find out a room for yourself. Stay there as much as you can. Avoid the common areas of your house, for example, the dining room, TV room, things like that. And if you have kids in the house, have them stay away from you as much as you can. Fortunately, by the way, they are a little bit more protected against this virus, but not, make no mistake, they are not immune from this virus. And then use your own soap, personal use stuffs like toothpaste, toothbrush, your own towel, and use your own clothes at a place. After you use it, just put it at a place and wash it as soon as you can. Now, if somebody gets sick and to the point when you need attention, first of all, if you get sick, contact your primary doctor, contact the nearest hospital. You have each and every hospital pretty much have opened up a cell for this to deal with this virus, and there are numbers. For example, our hospital has got a number to call. You call that number and they will guide you from there. Means like you might need testing done, and most of the places have got ability to get the testing done. At least you know the result, whether you are having a coronavirus infection or just having a regular common cold. Now, if you do have an infection, documented infection, then obviously, as I said, like if you can stay home, if you're not too sick, then that's the best thing to do. Just running into the hospital emergency room or doctor's office is not going to help you, because there is no specific treatment to offer you. In the media, we hear all those things coming up: chloroquine, hydroxychloroquine, antiretroviral drugs like anti-HIV drugs. These are all under investigations, and people all across the world are looking into it and see if it can be used to help out people. That does not mean that if you get a coronavirus infection, you are going to go right away some medications. That will be decided by your healthcare professionals. Fortunately, as of now, as I have gathered, that there is adequate supply of chloroquine and hydroxychloroquine. But don't just call a number if you have a little bit of cough and just call a number, I need chloroquine. That is probably not the right approach. So this is how what you do when you have an infection. And just to let you know that obviously elderly people with comorbidities like congestive heart failure, diabetes, chronic lung problem, they are they're pretty significantly higher risk. But younger people also is not immune from this disease. And so try to follow these basic guidelines you are getting from all the good sources. By the way, the media is throwing out a lot of things. It's very important to look at the right place for the right kind of information. So I would say there are a couple of websites I follow: cdc.gov, cdc.gov. That's the Center for the Disease Control. And then the other one I follow is WHO.in, World Health Organization, WHO.int. And also, people who are living in the United States, in Maryland especially, there are government websites, and also the Johns Hopkins University has got pretty good information on this issue. So stay informed, take the precautions. There is a lot of reasons to be concerned, but panic is not going to help. It is a huge, massive situation that we never have come across. And again, supplies are also important. Make sure that you have some basic supplies like basic food for at least like 6 to 8 weeks at home. I'm not asking to hoard things, but should have enough basic supplies. Milk, fish, meat, these are like day-to-day things. We will get it sometimes, we will not get it sometimes, but at least the basic staple food should be there for at least 6 to 8 weeks. Same thing goes with the soap, personal use stuffs like toothpaste, brush, detergents, things like that. So stay well. Hope we all get through this. and this thing ends. Good news is that a lot of places have already, it has slowed down. For example, like it started in the United States from Washington State, and that state, the new infection rate is pretty low. China actually is not getting any significant new infection of their own. They are more concerned now. People are bringing it from outside. Like as of yesterday, there were 45 cases in China who actually came from abroad into China. Places who did not follow all these isolation measures, they are paying a price. Unfortunately, places like Italy, we all know that death toll is rising every day over there. Hopefully, if we practice all these measures meticulously, we'll get through it. Take care.